we have heard lots of words, coming out from certain Republicans in the House of Representatives suggesting that hundreds of billions of dollars in cuts to federal Medicaid funding is too much, right? That will hurt their states, it will hurt their districts, it will hurt their communities. And we've also seen some senators, some Republican senators saying as much, right? Including Senator Hawley and Senator Collins, when the Senate was having its vote-a-rama a couple of weeks ago. So at the same time, right, the House did pass a resolution that would require $880 billion in cuts from programs under the authority of the Energy and Commerce Committee, meaning Medicaid and other programs. All indications, including, I believe, a recent CBO analysis, suggest that that volume of cuts would have to cut significantly from the Medicaid program, right? There are certainly folks on both sides of the aisle that really very much want to protect the Medicaid program. But if the Congress winds up with a reconciliation package that needs to cut that much from energy and commerce jurisdiction, it will wind up cutting a lot of that from the Medicaid program, unfortunately. I would say that there have been other times throughout our recent-ish history where Medicaid has drawn a lot of political attention. I was around in 2017 during the congressional effort to repeal and replace the Affordable Care Act, which included an effort to repeal and replace the Medicaid expansion that was part of the ACA. During that time, the importance of Medicaid played a really big role in discouraging members of Congress from repealing the Affordable Care Act overall. Medicaid was really in the spotlight, and a lot of people came out of that months-long debate and effort with the sense that Medicaid really saved the day, right? At this point, there are approximately 79, 80 million people covered by the Medicaid program. There were some fewer 8 years ago. But there was a recognition at that time that Medicaid was actually a political player now, right? And it mattered. The fact that it was on the table for big cuts mattered, and people voted against that. And ACAP has produced a report, we call it the Medicaid Voter White Paper, that does a couple of things. One, it shows how many people in Medicaid and the Medicaid expansion are in every single congressional district across the country. And you really get a visual sense of like how many people it is. And it's really important. And a lot of the biggest districts for Medicaid enrollment are Republican districts, or places where Republicans win elections. And that's a really important point, I think. It also provides a narrative history of where Medicaid played an important role politically with voters and with people who are voting on the Hill. So I think sometimes Medicaid gets a little less attention than Medicare, but when push comes to shove, certainly this year, certainly in 2017, but also at various other junctures throughout history, the history of the Medicaid program actually, and it's 60 years old this year. It actually has played an important political role.
I think it would be substantial, right? Significant, to say the least. Hospitals and health systems rely on Medicaid funding to, cover the cost of providing care for Medicaid patients. Where all of a sudden that funding goes away or is decreased, particularly things like not-for-profit hospitals have sort of very limited ability to immediately, sort of pass on those costs elsewhere, right? So they have contracts with payers, they have a mission to provide care to those regardless of, ability to pay. And so, hospitals, in particular nonprofit hospitals, rely on Medicaid funding. I think it's notable that Fitch's, which issues credit ratings, recently acknowledged that the potential decrease to Medicaid reimbursement would have a substantial impact on credit ratings for hospitals and health systems, particularly those that operate not for profit. Safety net hospitals, who have a combined self-pay and Medicaid payer mix of more than 30% of gross revenues, in particular, have really some significant potential exposure, right, as a result of these Medicaid cuts, because so much of their revenue um, comes from Medicaid. I think, Becker's this morning noted that there are 748 hospitals at risk of closure, almost one in every state. Half of those are at risk of immediate closure. Many of these are rural hospitals. And so if the federal government desires and state governments desire people to have access to care, then cutting off the Medicaid funding stream or substantially reducing it such that it becomes meaningless would inevitably result in additional hospitals closing.